Dr. Alexander Scott, as you're now starting, and you've kind of touched on it there, but to test asymptomatic people regularly, are you finding asymptomatic cases? You know, when a hairdresser shows up who doesn't feel sick but gets a test, or a massage. So I know it's early days, but what are you seeing so far with that?
Yes, it's still early on, but we are anticipating that we will see cases. But the serology results that I shared, this less than 5% type of number, is what we are anticipating we will see across the board with the early warning sentinel testing that we are encouraging the specific workers the governor mentioned to get tested. But that's the focus of doing it, helping to see what else can we learn, what other interventions can we put in place, how else can we support those people who are high contact workers, and doing a good job in providing services throughout the state.
Doctor, I was on the call with Dr. Philip Chen this morning. In fact, the article, my article on this will be up on motifri.com. But one of the focuses on that was, what do you think are the implications that there's such a radical disparity in seropositivity between races and ethnic backgrounds? In other words, my rough calculation is that Latinx people are about 3.7 times more likely than the average, the overall population to have seropositivity. The African American population about 2.4 times as likely as the overall population, and yet the white population is 0.4 times as likely. In other words, less than half as likely as the overall population. And what are the implications of that as distinct from PCR testing disparities, which are different going forward in terms of what the Department of Health and the state are going to do about it?
These data are in alignment with what we have seen with the PCR testing. And as I've mentioned, the serology tests are giving us information that we're learning more about. I'm interpreting that it means there has been exposure to COVID-19 in the populations, and given everything that we have described, the strong and resilient communities that are more densely populated and where there are communities of color are more exposed. So it is not surprising when you see serology results that reflect that. The time will tell whether or not we're able to say that higher seroprevalence then means that someone is not at risk of getting reinfected with COVID-19, and perhaps it adds to the ability of certain communities to be able to advance forward in certain ways. So we will still be taking in these results, doing additional analyses, and leading the way across the country in helping to understand how else we can interpret this.
The expansion to bus drivers, does that include taxi drivers, Uber drivers, Lyft drivers, and if not, why not?
We're focusing on the public transit at this point. We have a designed Sentinel early warning system program testing approach for these 3 months, and that's how we decided to start with those specific high contact workers. After these several months, we will be collecting that data, analyzing it, and then reassessing what is the best path as we go forward. With each month, as we all know, we all learn a tremendous amount more about COVID-19, and we'll have more information about the best next direction to go.
Doctor, in sort of layman's terms on two fronts. Number one, I hear from people, I'm sure we all hear from people, that I'd love to get tested because I think I had COVID in January, or whatever it may be. From a supply chain standpoint, how far away are we from a point where most Rhode Islanders will be able to have a serology test? Is that even something that's remotely on your radar screen? And then secondly, I guess more opining on those who would push the notion of herd immunity as something that we may have already encountered or are moving towards as we continue to reopen the economy.
So your first question applies specifically to a serology test, as you shared, and I want to make sure that that's clear, because the type of testing that we are encouraging high contact workers to go get is not a serology test right now. That is a PCR test, and it's one point in time. So it is not helpful to get that type of test to understand whether or not you may have had COVID-19 back in January. The serology antibody test that I just shared this data on the specific study that we were able to conduct is the type of test that helps understand whether or not someone may have been exposed to COVID-19 in the past. As I've shared, however, we do not have enough information about the test that says it is valuable at this point for an individual to get tested and determine if they're positive. We're still learning, even if someone has a positive PCR test and a negative serology test, what does that mean, or vice versa. So we are continuing to keep it a population level learning experience at this time, and are not yet ready to recommend it at an individual level for it to be a useful test, because nationwide there is not enough information to interpret it in a way that's going to be useful, and we do not want to promote false security about someone's exposure to COVID-19 and what that means for protection with going forward. From a supply standpoint in the future, I think that that will be less of an issue, and it's more so having the appropriate information for interpreting those results, which we do not have for an individual right now. Given the seroprevalence results that are the less than 5% in general, we would have quite a ways to go before we could say herd immunity is something that we can benefit from at this time.
Governor,
Good afternoon.
could I ask the doctor one quick question just based on what you just said there? What further steps could be taken to better understand if antibodies do produce that immunity? How can you kind of develop a better understanding of that?
Yeah, a tremendous amount of work is going on nationally to help get us there. We are just still early on. You know, we're just a few months into this virus. Many of these tests are very newly developed, and many of the previous antibody tests on other viruses take years for people to really understand how it works and what it means. And as an infectious disease doc for adults and children, I can say that even tests that have had antibodies, even viruses that have had antibody tests in place for many years, it's still tricky to understand. The IgG, the IgM, how do we interpret it? So with much thanks to our COVID-19 testing and validation task force, who are nationally and internationally renowned experts, we are on the front lines of getting the data information that help us know how much more we can start to rely on these serology tests, but we still have a way to go just because we're still so early on in the development of them.
Governor, good afternoon.
Good afternoon.
Don't think we forgot about you.
Yes, exactly. I was on break.
On Monday, you told me that you would have clearer guidelines on weddings by the end of the week, and I've heard from a lot of couples. I've also heard from the wedding industry. Very anxiously waiting to hear what you have to say today.
So, by the way, we did look into the specific instance that you brought up, and I appreciate you bringing that up. So, look, here's the deal. There's no new guidance for phase 2. Phase 2 is as it is. Social gatherings 15 and below. If you have it in a church or a synagogue or mosque, 25%. The rules are as they are. The question is, when are we going to get to phase 3? And we, as I stand here, I don't know. We like to do things for 14 days and observe for 14 days. So as I've said all along, you know, what I've been saying is early July. So I know that's unsatisfying, but it is what it is. So we are going to, next week, I am hopeful that we'll be able to have clearer guidance. This I know we will do. We are going to give guidance next week around what phase 3 will look like. And I don't know if next week I'll be in a position to say this is the date of phase 3.
The question I'm getting is, you know, flexibility and nimbleness with government. I understand you want to have guidelines, but the announcement you made several months ago, the data may look a little bit different now. And I know you want to wait as we go through phase 2, but the people that I've heard from since our article came out a couple of days ago is, oh, how come restaurants, you could replicate this setting? You said for high school graduations, be creative and get under the guidelines. In this specific case, and others that I know about, they're getting creative. They're submitting plans for social distancing, masks, testing, temperature, all of that. So they're trying to do it, and they're running up against a brick wall. So I wonder why there's no flexibility, and they see a double standard. Restaurants, you could accommodate 100 people at various tables, but I can't go wherever the venue is, spread out, socially distant. So why can't government turn a little bit?
Yeah. So look, it is a very fair question, and I am not pretending that these rules are perfect or convenient at all. We're doing the best we can, and the difference, we debated this endlessly, actually, this exact question, and here's where we came down. There's a difference between allowing, say, 50% capacity at a restaurant, which might have, say, 100 people at the restaurant, but there are 100 people who don't know each other, so they're not mingling with one another, right? We went out for dinner last night. We sat in our table, didn't really interact with the other people, and we left. If you have 100 people at an event, say a wedding, who all know each other, they're all going to be close to each other. They're going to be congregating. They're going to want to dance. There's going to want to be music. So for phase 2, when we're still trying to play it safe, we decided, and it's a tough call, believe me. It is a tough call, but we said, you know, there is a difference between an event with mingling and everyone knows each other and a restaurant. So the best I can say is it's a few more weeks. Hang in there. If you can wait for your wedding to be in July or August, it's going to be easier. If you have to do it this month, which God bless, these are the rules. The rules are what they are, and we're going to follow them.
Final question. Phase 3, and I've asked your communications people, there's no ballpark number right now. So can you at least give people a thought in the internal discussions in these meetings that you have? 50, 75, 100?
That's the ballpark.
You got to be thinking about it.
Yeah, no, what you just said is it. 50, 75, 100. We're also, next Tuesday, I have a meeting with all the other governors to see what they're doing. That's exactly where we are right now.
Governor, after your announcement Wednesday about schools, I think some superintendents expressed some frustration that they were kind of caught off guard, maybe not in the loop, and some reservations about how practical some of these things can be done, even though the guidelines won't be out till next week. What's your response to that, and maybe creating a little more questions than answers, as you've said sometimes?
So first, let me say I feel for them because they have a tough job. This is a tough job. We're going to do it. It's doable. But to start on June 10th or whatever and be ready for opening school with nearly all kids in school by August 31st, a lot of work to do. So if I were superintendent, I would be, look, understandably a little nervous and anxious, and I'd be getting to work, right, as they are, as they are. But the point is I don't want to minimize how difficult it is. And as I said, when I announced it, I'm asking them to lead. They need to lead in a very difficult circumstance. The truth of it is the commissioner has had lots and lots of dialogue with superintendents. They've known for a long time that they're going to have contingency plans, all in person, some in person, all virtual. So, we have been talking to them. By the way, we're going to continue to talk to them, right? So next Friday, we're going to have the guidance out. Between now and then, we'll be talking to them a lot. And then we're going to hold their hand the whole way through between when we give them the guidance and when their plans are due to us to make sure that they get it right.
And just to be clear, and I know a lot can change in the next couple months, is your vision to have all kids in school? I know you talked about staggering certain parts of it and hybrids, but is your vision to have all kids in school at the same time, or could there be, again, like a day on and a day off, a week on and a week off,
I
putting
wanted to
parents
see-
in a tough position?
I want to see plans for nearly every kid in school, like regular, every day. That should be our goal. We should be shooting for that goal. And everything we know now, like, the doctor just went through, if we stay on the trajectory we're on now, between now and August 31st, we ought to be able to do that. Now, maybe we can't, in which case they have to have contingency plans. But it is not enough to just have a plan for a hybrid model or an every other day thing, as you described.
Governor, the Christopher Columbus statue in Boston was vandalized, taken down. Should the one in Providence, in your mind, be removed?
That's an interesting question. It shouldn't have been vandalized in Rhode Island as it was. I think it's worth a discussion. I think it's worth a discussion. I have not, look, that's a difficult issue. It's a culturally important statue for many Italian Americans. It's also offensive to many others, and so I think it's worth a community discussion.
And the debate is, I just want to follow up, the debate is renewed about the state name change. I believe I read this morning you said you would favor that, but short of putting it on the ballot, would you consider an executive action to remove Providence Plantations from any state buildings?
I would support, I think it should be put on the ballot this year. I have heard from so many African Americans in Rhode Island, actually particularly in the past couple of weeks as I've been really amping up my efforts to listen, that it's a painful thing to see. Like state employees, every time they get their paycheck, they have to see the word plantation. Every time you get a proclamation from the state for doing a good thing, you should feel proud about it, you have to see the word plantation. So I think we ought to do the right thing, put it on the ballot, ask the people of Rhode Island to do the right thing and change our name. I suppose if that is unsuccessful, yes, I would absolutely consider doing what you said.
Governor, following up on the school issue, can you clarify, I've gotten some questions about the $42 million.
Yes, thank you.
Where is that coming from?
Thank you for bringing that up. So the federal government gave to all states, including us, funds to be distributed according to a federal formula to cities and towns to help them with COVID-related expenses. So where's it coming from? The federal government.
Is that part of the $1.25 billion?
No. It is a separate federal, I forgot the name, but it's a separate, yeah, do you know the name?
It's part of the CARES Act, but it's not part of the current.
Okay, so it's on top of the $1.25 billion. Every state got it. The feds have given Rhode Island $42 million and change. It's going to be sent out by RIDE according to a federal formula to cities and towns for COVID-related expenses.
So it's one time?
Correct. It is one time.
So you've heard the issue about transportation, that there
Yes.
might not physically be enough buses or drivers. And
Yep.
so in your thinking about coming back full-time in August, that's the big blowback
Yeah.
I've heard from a lot of school districts.
Which
What do you
is
say
real.
about that?
Yes, let me say a couple things because this is confusing because there's so many pots of money here. So we've got the $42 million, which we're going to release to cities and towns from the feds. That is separate from the state's budget funding formula. And right now, we have a tough budget to balance. We're probably going to be spending all weekend trying to find out what we're going to do. And everything is on the table for cuts. And we're going to look everywhere. And I cannot promise that there won't be some cuts to that education funding formula. In fact, I think there probably will have to be, just like there's going to have to be in many places. Additionally, we hope we're going to get more federal stimulus from the Congress, and we will be able to allocate to cities and towns in next year's funding formula. And on top of that, I fully expect to use some of the 1.25 to help cities and towns with things like transportation. So that's a lot of words to say the picture is murky, it's unclear. I fully expect, and that's why we got to get to work right now. So that's why, right now, I need to know from cities and towns, what's your plan for, not right now, but in the course of the next couple months, what is your plans for transportation? How much extra is it going to cost? And then my hope, plan, expectation, and prayer is that we're going to get more stimulus to help balance the budget, and then we use some of the 1.25 to help cities and towns with the extra expenses like cleaning, transportation, et cetera.
Dr. Alexander Scott, so on the data, can you just give us an update on nursing homes and the fatalities there? And is that still where you're seeing most of the deaths?
Our nursing homes are definitely working hard to address the fact that they are impacted to the extent that they are. The total number of unfortunate deaths connected to nursing homes is about 630, roughly 75%. Of the 10 fatalities that we announced today, 9 were associated with long-term care facilities. We are continuing the important work with nursing homes, making sure that the staffing support is there, the testing support. We're well into the 4th round of cyclical testing that is occurring among staff in nursing home facilities and including residents when an outbreak is connected to that. Also continuing to ensure that PPE that's needed is in place and the infection control guidance that's needed, both from a cleaning standpoint and all the way around. So we will continue to stay focused on this together with nursing homes.